Our bodies are masters of balance, especially when it comes to water and salt. But what happens when that balance is broken? What if the body holds on to too much water, diluting the salt to dangerously low levels? That's exactly what happens in a condition called SIADH, or the syndrome of inappropriate antidiuretic hormone. Today, we're going to break down this complex but crucial topic. To understand SIADH, we first need to talk about a hormone called ADH, or antidiuretic hormone. Think of ADH as the body's water-saving hormone. Normally, it's released when you're dehydrated, and it tells your kidneys to hold on to water to keep you balanced. In SIADH, the I stands for inappropriate. The body releases this hormone even when it's fully hydrated. This inappropriate signal forces the kidneys to keep reabsorbing water, leading to a state of being waterlogged. This excess water then dilutes the sodium in your blood, and that's where the danger begins. SIADH isn't a disease in itself. It's always a symptom of something else going on in the body. The causes are incredibly varied. It can be triggered by disorders in the brain, like a stroke, head injury, or infection. Cancers are another major cause, most famously small cell lung cancer, where the tumor itself can actually start producing ADH. Even lung diseases like pneumonia can be a trigger. Finally, a number of common medications like certain antidepressants or anti-seizure drugs can also cause the body to release too much ADH. So let's follow the chain of events. First, you have excess ADH. This tells the kidneys to retain large amounts of free water, which makes the urine very concentrated. This extra water then enters the bloodstream, and while the total amount of salt in your body hasn't changed, it's now diluted in a much larger volume of water. This is called dilutional hyponatremia. A key feature of SIADH is that the patient is euvolemic, meaning they aren't swollen with edema because the body isn't retaining salt, just water. The symptoms of SIADH are almost all neurological, and that's because the brain is extremely sensitive to low sodium levels. When the blood is too dilute, water moves from the blood into the brain cells, causing them to swell, a condition called cerebral edema. In mild cases, this can cause nausea, headache, and muscle cramps. But as the sodium level drops further, the brain swelling becomes much more dangerous, leading to confusion, lethargy, and life-threatening emergencies like seizures, coma, and even death. Diagnosing SIAD is like solving a puzzle with lab results. We need to see a very specific pattern. In the blood, we look for low sodium and low osmolality, which confirms the blood is dilute. At the same time, we look at the urine and we see the exact opposite: high urine osmolality and high urine sodium. This tells us the kidneys are holding onto water and trying to dump sodium to compensate. Finally, we confirm the patient is euvolemic, no signs of dehydration or fluid overload. This combination of findings points directly to SIADH. The treatment for SIADH starts with two simple but powerful strategies. First, and most importantly, we have to treat the underlying cause. If it's a medication, we stop it. If it's an infection, we treat it. But while we're doing that, the cornerstone of management is free water restriction. By limiting total fluid intake, often to less than a liter a day, we stop adding fuel to the fire. This allows the body to slowly excrete the excess water, and the sodium concentration begins to rise naturally. Now, if a patient is having severe neurological symptoms like seizures, water restriction is too slow. This is a medical emergency. In the ICU, we will give a special IV fluid called hypertonic saline. This is a very salty fluid that can quickly raise the blood sodium level to stop the brain from swelling further. However, we have to do this very carefully. Raising the sodium too fast can cause a permanent, devastating neurological injury. For less severe cases that don't respond to water restriction, we can also use things like salt tablets or specialized medications that block the action of ADH. And that is a complete overview of SIADH, a condition where the body's water balance goes haywire, leading to a dangerous dilution of salt. Thank you so much for watching. We know this can be a tricky topic to master. If you have any questions, please drop them in the comments section below, and let us know what critical care topic you'd like us to cover next. If this video helped clarify SIADH for you, please give it a like and subscribe for more deep dives into complex medical topics. Thank you for being here.